Okay, first of all, I want to welcome everybody aboard to this very special video conference. I'm Mac, and we have Dr. Robyn Scherber and Dr. Ruben Mesa, both big-time experts in the field of myeloproliferative neoplasms. And off the recording, Dr. Scherber, I had already asked this to Dr. Mesa, so I'm going to ask you. I told him, I said, you guys have got to be exhausted just from the mental stuff, the emails and the phone calls, and, in addition to what, your everyday routine. So how are you doing?
Yeah, well, I'm doing well. I feel really blessed to have my husband, and we've been trying to weather through this, and it's been tough in terms of trying to come up with answers and figure out the best solutions to a lot of different problems that honestly I don't think we would have ever faced in our lifetime. But as much as I think it's bad for me, Dr. Mesa, he's sitting on task forces not only for the university, but for large portions of South Texas, and trying to help figure out these issues from really a systems perspective and a larger perspective. So he's been working really hard on this.
Yes, indeed. Sure.
On the plus side, you never know what will come in handy. So one thing that's come in handy is Dr. Scherber, in addition to being an amazing doctor, also raises some chickens. So we've been having some fresh eggs right off the Scherber farm, and that's been a real treat during this time.
Dr. Scherber, I want you to FedEx me some eggs pronto.
All right, I will work on that.
Okay, so now my first question, and I want to start this off with talk of coronavirus and the impact it may have on us and how to better arm ourselves against it. But those of us with PV, now, are we in fact at a higher risk than someone who's without?
So Robyn, why don't you take the first stab at that?
Sure. Well, the bottom line is we don't have any data as of yet of coronavirus and PV and how it impacts our patients. But what we do know is that patients in general with PV, we can see an increased risk of some infections, including some viral infections. We have seen in coronavirus and other populations that across the board, patients with cancer tend to have an increased risk of coronavirus. It's hard to determine how that will pan out for PV. And all things considered, there's some patients with heme malignancies that are more at an increased risk compared to PV of these infections, but we still want to do due diligence, which means things like trying to wash your hands, the social distancing techniques, staying at home when you can, and generally taking good care of yourself. I think those are all very prudent things that PV patients can do to try to avoid getting the virus.
Okay, so I get the feeling, and I guess in a way maybe you answered this already, but there are different levels of risk, right? So what are the things that determine that? And I guess what I'm really saying is it the symptoms alone, or I'm not really sure what I'm looking for, like, if I feel funny.
Sure. Well, maybe I'll take a stab at that. So first, let's talk a little bit about the virus, because I think it helps in understanding kind of this issue of risk. Why is this so much more severe than the things we're normally used to dealing with, like the normal flu, like influenza or the cold? And part of it is that there's a subset of people who develop the infection, who then really have a second step. That second step is they develop a pneumonia that has a lot of inflammation associated with it. So the lungs get really damaged. So that's one of the reasons why there's been so much discussion of ventilators, intensive care unit beds, and why it has been such a strain. It is a more serious illness in a still less than 10% of people who get the infection, but enough that, that's obviously a huge problem. And clearly there are a lot of individuals that are passing away from this. So one of the things we've learned is that, unfortunately, anyone can be at risk of that second severe step. So although there's clearly groups that are at higher risk, it doesn't mean that everyone else is completely off the hook in terms of that risk. Sadly, we see people in their 20s, 40s, 50s who don't have other medical problems that have, passed away from the disease. So one, that's why it's so important for everyone to try to avoid getting it. Now, in the experience in China, which was kind of started this discussion, they found that people that had either advanced cancer or were receiving, cancer chemotherapy, had a much more difficult time with the infection. It's difficult to kind of extrapolate all the way from kind of that group, all the way to what it relates to patients with PV. But amongst patients with PV, one, there are the baseline risks that we know of. So we know that being older is a factor whether or not you have strokes. We know if you have other medical problems, heart disease, lung disease, those two put people at higher risk, or other diseases like diabetes, etc. Basically, the more medical problems you have, probably the higher the risk. Now, PV patients are really a very broad group. It ranges from individuals who are young, who are well controlled with phlebotomy and aspirin, have never had a blood clot and feel well, to individuals that have much more severe problems, enlarged spleen, have had prior blood clots, are on multiple medicines. So I think with PV, how well controlled they are, how old they are, have they had complications from the PV in terms of prior blood clots, have they had other severe medical problems, as well as, how are their blood counts? It is possible that individuals in which the white blood cell count is lower than we would like, lower than normal based on treatment, that too may increase the risk.
Okay, all right. And so with this coronavirus, and somebody was asking me about this, of course I don't have the answer, but if somebody with PV gets the coronavirus, do they continue taking their medication, or do they stop? I mean, because I'm thinking I would be worried that whatever you give me for the coronavirus, that maybe that medicine could possibly clash with what I'm already taking.
I'll take a stab at that. So right now, as it stands, the majority of people with coronavirus, they have done a couple different studies. It looks like the majority of folks have mild to moderate symptoms, and that it doesn't transform to that basically that pneumonia stage and the inflammatory stage that Dr. Mesa mentioned. So for the majority of people, I think staying on the medication that they're on is a good idea, just because we know that in other infections, once you get sick, there can actually be an increased risk of blood clots or other bad outcomes. And we don't want to have those outcomes with a mild to moderate form of the disease. The other reason why I would say I wouldn't necessarily go on or off your medication if you think you have corona, or if you think you're even likely to get coronavirus, is that, again, we don't have any reason to say that you can't stay on the medications you're on, and there are robust monitoring programs for our different MPN medications to make sure that everyone does stay okay on their medications, both long-term and short-term. But also because some of the medications we use in MPNs are actually being looked at as treatments of coronavirus. And so this includes not only interferons, but also JAK inhibitors. So I think it stands to reason that, although you could argue even some of the medications might lower blood counts, might impact our immune system, there's been thought that maybe they might even predispose to getting the infection. At the same time, they're also being looked at as treatments. So I think right now, the best thing you can do for your own health is to try to manage those blood counts appropriately. I wouldn't want them too high. I wouldn't want them too low. And to talk with your doctor if there's any question of whether or not you should go on or off a medication.
Okay. And now,
You know, and I would just add, you know, I think it's a natural reaction for folks to think that, you know, less medicine would be the way to go during this period. But, you know, the converse really might be true. You know, a patient who's well controlled with their MPN is probably at less risk of developing the infection than a patient who is unstable, meaning the counts are going haywire, or they've come off their JAK inhibitor, or they've just stopped their interferon. You know, being stable, feeling well is probably a much better way to, you know, fend something off than being destabilized by doing something abrupt with your medicines. So I and some other colleagues from around the world, we put together some draft guidance for the American Society of Hematology that's been posted on the web for hematologists who are referred to kind of by disease. What should we do? You know, for the most part, we've advised with MPNs to not make any drastic moves, because making a drastic move to protect the patient might inadvertently, you know, either ask for problems related to their MPN, they develop now a blood clot or something else, or two, might ironically make them more susceptible to being infected rather than less.
okay. All right. Now, this virus, can it at any way, in any way, impact your blood count? And I guess I'm asking, you know, for more or less in a negative fashion.
That's a good question. At least from what I've seen, so not only can markers of inflammation go up, so things like a ferritin or a C-reactive protein, and we do see those actually elevated in MPN patients as well at baseline. Not in all MPN patients, but some. But you can see some changes in the white blood cell count, and especially changes in the lymphocyte count that goes into calculating the white blood cell count. But for the most part, especially those changes in lymphocytes are not something that we normally see changed in MPN patients. How that really goes to influence the disease course, that really hasn't been figured out in terms of the coronavirus. But yes, it does have the potential to impact the disease, or sorry, impact the blood counts in general.
And I did see this as a question yesterday. Robyn helped to lead for the MPN Research Foundation a Twitter chat, and there was a patient that asked the question. They had seen their platelet count go up kind of in isolation, and was that potentially a sign of them being infected? And I'd say at the current time, not that we'd be aware of. So again, probably would not expect just the blood counts to be a clue. You know, really fever, respiratory symptoms, those sorts of things. But the blood count alone probably will not be the clue that someone might be infected.
Okay. And you heard Dr. Mesa, those of you who might not know, you heard Dr. Mesa refer to MPN, which is for myeloproliferative neoplasms. That is, in fact, the umbrella that these blood disorders fall under. Okay. So now we're going to get to the nitty-gritty. Are there any extra precautions, doctors, that we should take in advance of going to the clinic and getting our regular blood work and so forth?
Yeah, either one. And I know, Mac, we've talked about this at least a little bit. I do think that trying to avoid large crowds if you can is a really good idea. And certainly I think a lot of us are doing that with the new social distancing restrictions and ordinances being put in place. That being said, it's hard to stay in the house entirely during this time. So I really think if you have to go out, if you have to go out for work, I'm more than happy, at least for my patients, you know, for a lot of them, I've been trying to help what I can with their work arrangements to see if we can't make some sort of accommodations for them, maybe that they can work from home more easily. That for some of them, they've elected to take some FMLA or Family Medical Leave Act time just to be able to spend at home. For those that that can already stay home, I do highly encourage that again, especially patients who are retired or are able. The complicated thing can sometimes happen when a patient's significant other still has to go in for work. Things like when a patient's, I've had a question of, one of a patient's family member worked for an airline and he was a pilot. And they were asking, what do I do in that circumstance? And again, taking these other precautions are kind of the best thing that you can do. So before you eat, wash your hands frequently disinfect different parts of the house that are being used. So everything from doorknobs to bathrooms to kitchen utensils, make sure you're getting all of those things as clean as you can. Yes, exactly. If you do go out there, initially there was a lot of mixed data on whether or not you should be wearing masks. I do think that in general, it's a good precaution. So it's not a perfect precaution. There's, again, a lot of mixed data on whether or not it helps or not, but you can say for a good degree of certainty, even if it doesn't necessarily help you not get the infection, if for whatever reason, if you had it, it would help you not to spread it. So I think that would be a really good thing to try. Yeah, otherwise just staying healthy as best you can. So eating well, still continuing to exercise. We know if you don't exercise or stay active, you can be at increased risk of blood clots, and we definitely don't want that. And then staying healthy mentally as much as you can. So still trying to connect with people, try to still, do FaceTime if you can, have that human connection. Dr. Mesa and some of our good colleagues have worked closely with the Calm app and mindfulness and meditation. I think that this more than ever is really something that you might have the time and bandwidth to try to pursue. And it can really help with basically feeling centered in the world, especially when you turn on the news stations. Yeah, Dr. Mesa, anything else that you would add in terms of ways to?
No, I mean, I think those are really the key. I think to take everything that they're recommending for the general public, but really, take it quite seriously. I think particularly during this period where there's really the greatest risk of exposure. I think, how that will evolve kind of after the surge, I don't think any of us really know yet kind of what those guidelines are going to be, but I think really trying to follow them as best you can is really key. None of us truly know for the individual PV patient, what is at risk. I do think that it's helpful for individuals just to connect with their physicians, either by phone, email, virtually. Both Dr. Scherber and I are doing many video visits with patients if it isn't necessary for us to see truly them face to face. After we're done with this discussion today, I have 3 patients that I'll be kind of seeing through my computer, and part of that is kind of seeing how stable they are with their MPN at the moment. Should we adjust the dose of their medication, how they're feeling, etc. But part is, how does this COVID relate to them exactly? Because looking at all the medicines, their health, their situation, and again, trying to advise as best we can. So I think it is a good time, to connect with your physician. Natural questions arise. Do I need my blood test this April? Have they been stable enough that I can wait and get my blood counts in May? Maybe that answer is yes, maybe that answer is no. If I need a phlebotomy, should I go in? Probably yes. If so, where? So all of those, specific things are really helpful, I think, to connect with your hematology team regarding.
You actually just answered my next question. It had everything to do with whether or not, we're at risk going to the hospital. If we need a CBC or a phlebotomy, can we hold off? So you just answered that question. Okay, so with that, I'm going to open the floor to anyone else who might have some questions. Let's see. So I just unmuted everyone. So if anyone has any questions, hopefully everyone doesn't jump right in at once, but does anyone else have any questions? Don't be shy. Okay, so.
Can you hear me?
Oh, go ahead.
Can you hear me?
Yep,
Okay, I have a
you're
question.
fine.
So I've been on Jakafi since October. My counts are good. I'm not due for blood work until May. We were going every 2 months now. I'm also a nurse, and I'm not really working much in the dermatology office, which is good right now. But I hear I'm a little more immunocompromised being on Jakafi. But it also sounds as though if I would get COVID-19, it may help me with like a cytokine storm or something. Is that what I'm understanding?
So it's a good question. There's been a lot of discussion regarding the JAK inhibitors, and I think, so there's a couple of points. One, we're thinking that patients who are on Jakafi are probably best not coming off it because it might, again, kind of destabilize the disease and put people at greater risk. We think, one, that if you're on Jakafi, yes, you might be slightly more likely to get the virus if you're exposed to it, because it probably has a little bit of an effect on that immune response. Now, it may not mean that for every individual, but just overall, we think that that might be slightly the case, and that the rates of infection with Jakafi are a little higher, not dramatically so, but have included the reactivation of herpes shingles, which is a type of virus infection, hepatitis B, etc. Now, there's a second component in that, independent of the issues of an MPN, ruxolitinib has had a benefit in people that have the coronavirus. So specifically, they have done some trials, and now there's a larger trial ongoing with Jakafi for individuals that have the COVID pneumonia that are on a ventilator, and that it has helped people get off of the ventilator through some of its anti-inflammation properties and working against the inflammatory cytokines. What we don't know is the question that you're asking is, if you're on Jakafi and you get infected, are you less likely to have a severe pneumonia? That may be the case, but we truly don't know. Robyn, your thoughts, other ways of describing the Jakafi piece, because it's a complicated discussion.
Yeah, no, I agree with that. Right now, we just really don't know, but we can see other viral infections that have increased risk in people on JAK inhibitors. But that being said, yeah, would it potentially help this to become more of a common cold? Potentially, and not get into that inflammatory phase. What I can say is that there are, again, they have in place monitoring programs for patients who are on Jakafi and on fedratinib, Interbec, the two JAK inhibitors that are currently commercially available for myelofibrosis, and that they are looking for those signals to see if there's harm, or potentially even if there might be benefit, I think, long term.
Right. Okay. Anyone else have a question? I'm put one or two people on mute because I heard a little background noise. Not accusing anyone, but I was trying to snuff it out. But feel free to take yourself off mute, or I can do it for you either way. But do we have any more questions for the doctors? Okay. Well, I'm sure I want to say it's to both of you. First of all, thank you again for taking time out of your busy schedule. I know it must be like crazy, but I appreciate y'all coming on with us. And I'm sure there are going to be, we don't have a lot of people on here. I expected more, frankly, but I'm sure there are going to be a lot of people listening to this recording because I'm getting text right now about it. So I don't want to take any more of your time. I want to thank everybody. Dr. Scherber, good to see you as always. Thanks again. And Dr. Mesa, good to see you, sir. Keep up and you all stay safe.
Great. No, and thank you very much for including us. I mean, clearly this is an incredibly stressful time for folks, and when you have a chronic disease like PV, it adds that much more uncertainty. So more than happy to help. And we'll have Robyn forward you the link on the ASH website in terms of some of the guidance that we provided to physicians, just so that folks can kind of see what we wrote up about that, just to see if that's helpful.
Yeah, I'd be happy to do that. And Mac, thank you so much for putting this together. And it's been a real honor.
Well, no, the honor was mine. For those who don't know, Dr. Scherber is my doctor. And the first time I met her, I believe it was back in November. And I told her about the Titanium Strong Foundation and told her about the groups on Facebook and so forth. And I posed the question to her, hey, would you mind if I did an interview with you? And eventually that became, well, how about if we have a conference? Well, with coronavirus rearing its ugly head, that's how we came about this video. And Dr. Scherber told me, hey, I think I could get Dr. Mesa to get involved too. He does these things. I was like, yeah, I know, because I've done my homework. I've seen y'all on YouTube. So, I want to thank you all again. This has been my honor. And, for those of you all who are watching, I'm representing all of us. I got to stand up, but you see the shirt?
It's a great shirt.
Yeah.
Thank you. So thank you both again. Thank you all for tuning in and joining us. And we'll see you all again soon.
Great. You take care. Bye-bye.
Thank you, doctors. Thank you, Mac. I appreciate what you did for us today. Thank you very much.
Thank you.
Thank you.
Dr. Scherber, I want my eggs. I'm sending you my address.
Okay, sounds good. All right. Sounds really good. Talk to you soon.
Thank you. Remember to do something nice for somebody today.
Thank you, sir.
Ricochet, take your